of sharing and connecting. So what I'm going to do is talk through an article that was sent to me by an editor a few months ago that I've found so helpful. I've been using it over and over and over again and referring all my students to this research. And it's helped me tremendously in terms of just ensuring that my themes, in particularly thematic analysis, are very well developed, but also working towards argument in those themes. Yeah. Salia, just to check, can you hear us? Everything okay on your side?
Hi, Jennifer. Yes, I can hear you.
Perfect. Yeah. And just to do a round of introductions. So Salia's a PhD student in neuroscience, neuropsychology, and Alina and I are co-supervising her project. We've got, do we just want to do a quick round? Who are you and what are you doing?
Sure. Hi, I don't know which screen to look at.
The camera's this side.
Okay. Hi, I'm Megan. I'm a postdoc student in the HCOU.
Hi, I'm Rona. I'm a speech therapist and I'm a research assistant.
Hi, Celia. I'm Sondo, PhD student and a research assistant at HCRU.
Hi, I'm Johanni. I'm also a postdoc fellow at the Neuro Lab as well as in the HCRU.
And I'm Siobhan, and I'm a postdoctoral fellow also with the HCRU.
Hi, everyone. Nice to meet you virtually.
Yes, and so we hope that we can recruit some more people in future, and we'll see how this group goes. But it's just about sharing amongst the few of us, even if there are not hordes of people here. All right. So the article that I've selected for today is by Connelly and Peltzer, and it's about underdeveloped themes in qualitative research. So this notion of really stretching a theme beyond just plonking a word on a piece of paper. So what do we mean by themes? I think that's a good place to start for some of us who haven't perhaps done a lot of qualitative work. So themes are something that we use as part of thematic analysis, either as part of an inductive or a deductive approach. So inductive, where you allowing the data to kind of reveal the results and show the results, or deductive, where you are applying objectives or particular questions that you have to the analysis. What you do is start coding data, group those codes into categories, and then out of that you start to see themes and sub-themes that you start to group together and figure out what are the links and how do they overlap or relate to each other. So themes are something that provide us with an interpretative description or reframing of a phenomenon. So we really want a theme to give us meat and meaning in the data. Bearing in mind that this is always a subjective approach, so analytic reflection is something that's going to happen during this process of analysis. There's an interpretive lens that the research is applying to the data, so it's quite subjective. But what you really want to do is to bring out meaning from the data, try to explore relationships between ideas, offer insights, and really the findings that you then present in an article or in a paper or report are the interpretation. It's not the data itself. So just to make that distinction. Also, when we talk, sometimes we talk about themes emerging, like something coming out of a swamp. Themes don't just emerge. It's something that you as a researcher are crafting and identifying in the data. So if you see people writing about themes emerging, just think of like a swamp creature emerging. It doesn't happen like that. Okay. So the problem, I've got some funny figures there. The problem of underdeveloped themes. So an underdeveloped theme is something that's unclear. I'm going to give some examples just now. It's very limited in terms of what it actually conveys. So you read it, and so something like fear. What is that? Fear of what? Fear in relation to what? So underdeveloped themes can be very frustrating for a reader, also for somebody, for the researcher trying to make meaning. That if you're just conveying it like a one word, it's not actually giving you the depth and the richness of the data. But you want to push for further analysis. And if you've got underdeveloped themes, you're going to struggle to get published, because now journal editors and reviewers are much more aware of, you need to actually have developed themes. You need to push this further than just saying fear, stress. And I'm looking at all of us because I know we've done this in projects, me too. I can think of projects where I've given underdeveloped themes and, not a good idea, needs to be reworked and pushed more. So an underdeveloped theme doesn't convey enough about the phenomenon. There's often a disconnect then between the theme and then the quotes that are given, or the quotes sometimes end up being given also in a very superficial manner, and not really delving in and pulling out the meaning of those quotes. So sometimes the narrative that accompanies the quotes is really superficial. There's often a lack of explanation of how the themes relate to each other or overlap. And I think that's quite important, because sometimes there is tremendous overlap between themes, or significant links between themes. And I'll show some examples later of how I think that could work. Often an underdeveloped theme, as I've said, is something like one word. Sometimes it's just a concept like stress. The examples I gave in this article were collaboration, autonomy, coping, lack of support. Yeah, I don't know, we're all grinning because we've all done this before and thought we were doing a great job of analysis. So how do we push it further? So I found this quite interesting in the article. They talk about two main causes of underdeveloped themes. So the first is that you actually didn't do a good job of the interviewing. And I think that's a bit of a scary thought, because if you haven't done a good job with interviewing and you've got superficial data, then your themes are going to be superficial too. So, and that's a tricky one just from experience, because some projects are going to give you really meaty data and others aren't. Like if you're asking about what did someone understand in a consultation, you're not going to get someone's life story and this whole meaty, rich set of data from that. Yeah, I don't know if anybody else can think of examples where perhaps they could have interviewed more thoroughly. Yeah.
I have to say that I didn't really see a huge difference in the table that they included at the end about the difference between a good and a bad interview and a good and a bad probe. It didn't.
I didn't like that table, to be honest.
It didn't come across clearly at all to me. So yeah, I think that's example of a bit vague.
But isn't it like it can also be a bit of an iterative process that, like, like with the interviews with Charmaine, there's like some things that you can see. Maybe you can see now, looking at the data, that maybe they could have probed further with a particular thing. Now that you're looking at it afterwards, but it would have been difficult, I think, to know that beforehand.
Exactly.
So you can kind of go, not maybe to the same patients, obviously, but like if you do another project, then you have that in mind.
Absolutely, yeah. And I mean, that happened with me with a student project recently, where student was looking at experiences of volunteers running stroke support groups, and I'd helped her to design the questions, and then I agreed to be her pilot person. And when we sat and did a pilot interview together, we suddenly realized, oh, there's a whole other line of questioning that we need to include that we didn't. Yeah, so it's not a perfect process. And there is this need to cycle back. So, collecting data, reflecting on an interview, going back, thinking about, do I need to probe further? Do I need to do more? Have I done enough? Is there a particular phenomenon that perhaps is emerging that needs more rigorous probing? Yeah.
I don't know if this is the right place to actually say this, but I suppose I'm kicking back a bit about the fact that a theme has to be wordy. you know, that a one-word theme is wrong. Because my feeling is often when you've got like a long explanation, what it says to me, and I think I'm coming from my bias of working with kids who can't summarize, is actually you haven't understood. So, you know, if you can condense something into a key concept, which very well could be one word, for me, that means that you've actually had that executive system of sifting out important versus unimportant.
Absolutely,
and I'm actually uncomfortable when somebody says, working together with positive attitudes in an environment that is trustworthy, instead of saying something like collaboration. I do think that there is a value in being able to distill it down to one concept in terms of being able to understand. So I really struggled with that in this article.
I also feel like I had the same idea reading this, that I think I had the wrong idea of doing qualitative research, because I also thought like that you had to funnel things. I thought it was you have the code, you have the category, then you have the theme. And to me, in my mind, I felt like you had to summarize the theme. So reading this, I was kind of like, I have no idea what I'm doing.
Well, this is why I thought let's share it, because it was shared with me by an editor. It was in response to an article I'd submitted, and I also thought, oh my goodness, I know nothing. Like, I've been doing this completely wrong for years in terms of what they are suggesting. So so I think that's interesting to consider the interview side of things and how well that is done, and then also the analysis and the interpretation. So they go hand in hand. And I think for me, that's a huge challenge for particularly fourth year projects, even master's projects, where people are starting out and they haven't done this before, and then you say, off you go and do interviews.
There's so much like preparation required, and then I think even if you're wanting to collect data in a language that you are not a first speaker, and you're using a research assistant, you know, again, sort of there's that again that sort of potential for broken telephone, or sort of where things can become watered down because of the lack of preparation prior to actual data collection.
Or absolutely, like there's a question that Charmaine has in her interviews as well. That's the question is there something that you would want the doctor to know about you that you kind of feel is relevant? And it seems that it just gets lost in translation, and people are just like, what are you asking? Like almost in every case, people are like,
what do you mean?
What do you
know? The subtlety is lost.
Or the way the question is asked, maybe needs to be more specific, or needs to.
It's now happening in another language, and we're seeing the translation back, and all we see is just this person is just like, this is a weird question. Why would I? Like, what do I want the doctor to know that I'm going to get better. Like, that's what I care about. Like, they need to kind of, I think they should know that I'm having these side effects, or I think they should know that this is really important to me, or, you know, that's not coming out of it.
The intention versus.
That subtlety can get lost.
Exactly.
Because again, I think it's just me kicking back a little bit. Like, I think that academia's got a bad name for calling a simple phenomenon something very complex. And I think we do it absolutely deliberately. We use jargon, and it's a snobbery thing. It's to exclude the layman. And I think we've got to get over ourselves and actually just talk about things quite broadly and as clearly as possible. And I think that there's almost like, this article feels like, you know, you mustn't do that, you know, for goodness, because they're saying, okay, no, the reader won't understand if you say collaboration. They will understand if you describe it in great detail. I get that. On some level, I do. But, you know, sometimes I think that there are concepts that need to be distilled down, and that's our job as a researcher.
But perhaps then we could suggest an interim step to this article to say that distilling process needs to happen. But then once you've distilled it down to something like fear or collaboration, then you need to say, well, what am I actually saying about that?
Expand on it.
And then maybe expand on that a little bit into a shorter phrase instead of a long. So I don't know, maybe a suggestion. But I must actually lend you, I've got a wonderful book on academic writing style. And what the author does is she takes pieces of work from some of the top publishers in academia from all sorts of fields, and she analyzes how they write, and they write simply.
Yes,
so simply.
Because they understand it.
Yeah. So, and it's magic when you actually
Yes.
get that concept that you don't have to write in this convoluted.
Makes me think of
Professional language.
the conversation, that writing group that make science sort of accessible to the public, and they ask you to write about your
Yes.
research in sort of 2 pages
In layman's terms.
in layman's terms,
Yeah.
and it's quite a tricky exercise actually,
Brilliant.
and it's we attended a course on it, and it was fun.
Yeah, it's very, very interesting to do that. So yeah, I'm trying to type a message. So Leah, if you want to chip in or say something, please feel free to, or put your hand up, or just jump into the conversation.
Thanks, Jennifer. Thank you.
Okay. So I think the principle here is that qualitative interviewing and analysis can appear really deceptively simple, but it's a lot of layers and a lot of going back and forth and back again to the data, and sometimes going round in circles, I think.
Yep.
Yeah. So links between themes seem really important. So thinking about relationships between ideas, categories, domains, whatever it is that you're actually looking at. Bearing in mind, just as a side note, that sometimes you're not going to end up with well worked out themes. If you've got really superficial data on a superficial topic, and that's okay, you might end up with domain summaries. That's how Gordon Clark talk about them. So like not quite as meaty as a theme. So that might be something that you end up with. So for example, that dreadful survey paper that Amisha and I are trying to work on, that's got domain summaries because it was very superficial. It's like, what is your university doing for simulation? You're not going to get anything meaty out of that in terms of themes. It's not going to lend itself to giving you a theme. Yeah. So I think also trying to give the reader an understanding of the big picture. So something I've been doing with 4th years now, which I think has been really helpful, is they're getting so lost in their themes and sub-themes. And then what I say to them is, let's write on an A4 size piece of paper, and they can take a photo and email the handwritten note to me of what is the central phenomenon, what are the themes and sub-themes, and how do they feel that they link and connect. And then sometimes they'll write little notes like, I don't know where to fit this bit in. And then I can help them because now you can see a bigger picture of, okay, move this one here, present maybe this theme first, and then move to the others. So kind of getting a sense already of argument, which I'll talk about with some examples just now. So that for me has been quite helpful. I don't know if anybody's got other helpful strategies that they've used. Was trying to make sense of getting the bigger picture. Honey, maybe. Oh, sorry.
No, that's how I have done it in the past, is taking an A4 piece of paper and just, and then, you have like these floaty bits on the side. I'm not sure. You sort of park it for a bit and then give it some thought, and then eventually it does kind of, it either fits somewhere, or sometimes you end up finishing the project or the paper still feeling like you have these bits and you're not sure what to do with them.
I was thinking, Johanni and Sonto, of that mental health project, which had so much data, and how we managed, I don't even know what we did in the end to try and make sense of and distill down to themes. But I think that did require a process like what Rona's saying, of really distilling down to central themes.
I think we did kind of like, well, I don't know if it's the correct way, but we kind of did like a content analysis, because I also did some tallies as well. I don't know if you remember.
Yes.
In my mind, that makes sense. I don't know if everyone thinks like that, but in my mind, that makes sense.
It worked for that project, to actually have tallies to give a sense of saturation and what themes are popping up more frequently.
And I think that's where sometimes the AI helps, because if you're looking for keywords, for example, how often does a keyword come up? But I'm surprised how that doesn't, logically it seems to be something that would work so beautifully. But in practice, I don't know, it seems to give you this mountain of stuff. Yeah, and I think that's the human factor is, you know, you get a sense of what people are saying, even though they're not using the same words or the same way of expressing things. And yeah, that's why I think it's quite interesting to be able to distill it down.
With Charmaine, we haven't like developed themes yet, but one of the things that seems really helpful is like two people looking at the same data set, because there are things that she'll pick up on that I'll miss and things that I'll pick up on that she'll miss.
Yeah.
And it's also, you know, when you were saying something about themes emerging, and some of it seems to be very dependent on her experience as a clinician, and I have a very different, I'm thinking about, I think I have more of like an educational teaching background. So I'm thinking about what does the person understand, and I see more of that stuff, and she sees more of like, you know, disease progression and symptoms and clinical indicators, which is very interesting. It's like, I mean, I feel like that in itself is like, if we had to compare what I find and what she finds, that in itself would be an interesting study.
Well, that's where we've been moving, for example, with a paper that Rona and I are trying to put together, where this insider-outsider perspective story is very useful. And we've used it, for example, with that audiology project, the family medicine project, where you've got insiders who are actually working on that particular phenomenon. And then outsiders who have an understanding of health communication and qualitative research, but aren't inside the environment. But then what Rona and I have found, and that's been a huge issue to actually untangle ourselves from, is what we call extreme insider perspectives. So now, for example, in the telepractice study, we were once students. We've both been and are clinical educators. We are both researchers. We are speech therapists in private practice trying to navigate telepractice ourselves. A clinical educator trying to navigate telepractice supervision, and a course coordinator. So now you've got multiple insider perspectives going on. And that for us became really, really challenging then to try and get that, you know, what are we actually looking at? What are we seeing?
Then maybe you need someone else who's an outsider in those ways to look at your data
Yeah.
and reflect.
Which is what we did in that project. But it took us a while to figure out between the two of us. That was where the biggest issue lay in terms of analysis, was the two of us and our perspectives. The outsider, insider, that was okay. It was the insider.
Yeah, and I think they talk in this paper about the importance of reflective practice. And I think that we bandy the term about, but I think it's an extremely difficult thing to do.
It is.
Because, and I think in the real world, you kind of pick your point. You know, you pick what you are going to focus on, because you can't be everything to everyone. It's not a one size fits all. So identify your bias, understand the consequences, and then move on.
Absolutely.
That's
So
what I
did
think
you?
works.
Yeah.
Oh, no, I just remembered what we did with the telepractice.
Yes.
Project, where I remember we were analyzing the videos with Rona. And Rona, you know, came with like a very clinical analysis, and then Johanni and I, because we're not sure what's going on, and then we brought in something like
Yeah, so that project was the trickiness lay with Rona and I. We had a lot of conversations about what are we actually looking at, and how do we disentangle ourselves from trying to judge the efficacy of the therapy, or how is this good therapy or bad therapy, when actually we're trying to look at telepractice and how's that manifesting and what additional challenges does that bring. So I mean, I think Megan was maybe an insider, outsider in between in some ways, because in that project, because you have had some experience of working with students, and that's part of your postdoc.
And doing teletherapy.
Yes, exactly. So you were somewhere in between. And the two of you were complete outsiders. And so that was a fascinating project. And I think we really do need to pursue writing up some of these. I think Amisha's keen to write up a paper along similar lines with the experience with the audio project, because that was also an example of unclear insider-outsider perspectives, where, so I'm a trained audiologist, but I don't practice and supervise in that area, but I have knowledge. So I was the in-betweener there,
And I think these issues and topics in terms of grappling as a researcher are so important, and there are not lots of papers on these issues.
No.
Because it's often, the papers are often about the project or the data, but there's not a lot of papers on grappling with
the process.
With the process and the research issues. I'm just thinking of that ethics paper that you and I wrote, that reflective paper.
Yes.
And it was we thought it would be quite like
I didn't think that
arbitrary thing to write about, but we wrote about reflective practice and ethics and some of the challenges that we had as researchers. And I suppose because it was so different when we were writing about problems in the research process, and there's not a lot of papers on these types of issues, which I think
loved it.
That need to be discussed. I think
it came back with like 3 lines of corrections or something. What?
Yeah,
it was amazing because as you say, there's such a need for this kind of grappling with. So I think it's also important when we're looking at themes to think about what is said and what isn't said. So often the things that you would expect to find that aren't there, or those silences and gaps, and why are those there? So looking beyond the responses to try and convey meaning, and then searching for recurrent ideas, integrating data into some kind of unified, fully developed idea, which to me is about argument and kind of what am I trying to say in this paper and where am I going with things. Not easy. Sorry, this is very small here, but these are some examples they gave. So for example, in a study about the experiences of African American women living with HIV infection, the researchers had codes labeled stigma and another changes in relationships, but these codes or categories are not by themselves a theme. So stigma or changing relationship, not a theme. The theme was actually living with multiple layers of betrayal. So I guess they did that process of distilling, and then we'd probably have to read the whole study to see what they did there. And another one on nurse competencies. One of the themes was effective charge nurses made use of all their resources. And then I think I preferred some of the examples at the bottom there, things like collaboration versus collaboration between nurses is problematic. Collaboration is helping each other out when things get hectic. Corona's not liking this. Too wordy? Too much?
You know, for me, the skill is distilling it down. The skill is not describing. You know, I get a bit frustrated when people can't give me the main idea, because for me, they haven't gone far enough in analyzing. You know, describing what is there is one thing. I do think there needs to be an extra layer.
No, I hear you and I agree with you. And part of it, we would say, maybe with a therapist mindset, is learning how to summarize and really distill down to that main point, and then capture that in a way that's not endlessly wordy.
Because you know what it does when you say something like exactly that example, is it then narrows your discussion. Because if your collaboration, you know, then you bring in the things that you are seeing within the unit, that's your discussion. But if you've actually now said it's standing up for each other when attacked, then that's all you can discuss about collaboration. Because you've actually narrowed it down quite dramatically to only that aspect of collaboration. And sometimes I think that's not what's happening in the data.
Maybe meet in the middle somewhere to say that if you just say one word, it needs to be embedded or contextualized in some way. It can't just be
because people will put their
collaboration of what or where or with who. There needs to be some orientation to what you're referring to, I think, but not necessarily as wordy or as limiting in terms of describing one thing, maybe.
So I'm not 100% sure how this is done, obviously, because I haven't done this before. But surely within the article itself, you're already framing the environment, and you're framing who you're talking about nurses, you're talking about it's in this particularly, like you've given the context. So then to say collaboration, it's kind of implied that it's within this context. I think I would agree with you then, like this, you know, specifying, a lot of it is already specified by virtue of like where you're looking in the study, right? So, you know,
So long as you've actually done that, because some people also do a bad job of contextualizing the study. So, yeah, so that's, I guess, part of the writing. So just to give some more examples, this was the paper where the editor came back, or the reviewer came back with this article and said our themes were underdeveloped. So the original themes we had, current teletherapy practices. And they made some suggestions about how they wanted us to enhance them. And I think what is quite helpful is to have a colon and then a subtext. So current telepractice approaches, making the switch from in-person to online therapy. Accessibility, they wanted figuring out what works and what doesn't work. And we kept the working with specific diagnoses online.
that difference is when you're inside your own head, you know, like in your own head, you know what you mean when you say current teletherapy practices, but someone else reading it doesn't actually understand the specific question in the context of the time or the context of the place.
Yeah.
And like the second one, figuring out what works and what doesn't work, it tells you like what was your question.
Yeah.
Whereas like the first one, and I think it's one of those things of articulating the stuff that's in your head.
And it stops you being vague. I mean, I'm getting
So
that.
it comes back almost to presupposition skills, you know, that we talk about in therapy, where we
Take
say, he went there,
into account.
he went there, who's he and where's where? You don't know what you mean. So, yeah, so important to kind of, not fall into that trap. Sorry, Celia, we lost you. I don't know, the lovely bits internet. Okay.
We're back now, so it's okay.
Fantastic, yeah. So a well-written theme, according to Connelly and Peltzer, should summarize the key ideas and relay the complexity of the phenomenon. So I guess that's actually the key here, is to get into the complexity and the nuance. So you really don't want to present something that's a superficial account of the data and the themes that you have identified. I mean, I've been trying more actively as well with students' projects to push them towards nuance, push them towards, you know, don't just plonk a quote in, but actually have a look and see, what is that quote really saying? What is this really about? So for example, on that project with the student looking at stroke support group volunteers, there was a quote where somebody says something about, like, I really wish I had more time. I feel there's a lot of responsibility here. I just don't have enough time to dedicate to the group. And I said to the student, you know, there's a whole lot of stuff that's in there that isn't being said around guilt, around, you know, that needs to be explored. So you can't just plonk in a quote and say, volunteers said they don't have enough time, because it's actually about so much more than just the time factor. So getting into that complexity and nuance. So they've suggested a well-written theme is a phrase or a sentence. So here's where maybe we think a bit differently. I don't know, maybe. I think it's something to think about.
It's good good to challenge because
Yeah,
I'm
no,
coming back hard, but then I actually think I can see where they're going in terms of, I love the point circling back to what question are you actually trying to ask?
Exactly, yeah. What are you really trying to say? So I guess the theme also should define the concept in relation to the study, as Siobhan, as you were saying, in relation to the question as well. So, what are you really trying to answer here? What are you asking about? And what is this showing you? So the theme should include the interpretive commentary, which is an explanation, plus then support from quotes. And your analysis. So you need to give that narrative explanation with the quotes. Can't just plonk the quotes in. And that's really, I guess, the work of crafting and the interpretive lens and all of that, which is easier said than done.
I know just working with some matrics is they taught that thing peel. Have you I can't remember it. So when you're going to construct a paragraph, you have to have a point, you have to have the evidence, you have to have the explanation, and then you have to link it to the next paragraph or back to the question. And it helps. It helps people who've got no idea. I also did.
Yes, and that a paragraph should actually have one major point. Yeah, one point, not multiple points.
One point.
One point in the paragraph.
Yeah.
Yes.
And sometimes you can do a PEL, like the evidence and the explanation is sometimes the same thing, but not always. And especially if you're using qualitative research, you need that evidence.
Absolutely.
You need the quote. Yeah.
I like that. Thanks, Rhoda.
Anytime.
No, but this is the thing. I think when you're talking about a topic like we are today, you're drawing on all sorts of knowledge from different spheres. And it really is also about the writing and how you convey it. I think more than perhaps quantitative. In qualitative, it's all about argument. It's all about writing in a much, much bigger way. And that is the tricky part. Yeah. So this is a concept that I've been dealing with since I read this article is really how developing themes allows one to move towards argument. And that for me has become much, much clearer since I've been trying to develop themes more, is that it really helps, I feel, to get to argument. So instead of just saying like fear and stress and uncertainty, you've got to connect them and make an argument somehow. So how do you get there? So this is an example I've taken from this is a master's student of mine who is doing a study on speech therapist experiences of working with burns patients. So we don't get how to do this. You just get thrown into the world and told, go and see this patient. And
because they can't swallow. Yeah.
And you could be presented with anything and everything that might affect speech and swallowing, and there might be cognitive involvement and all sorts of other things going on. So it's quite a hectic thing. So what she wanted to look at was, how do they develop practice when we don't get taught it, and how do those therapists who've developed expertise in the area, how do they get to that point? And so initially the student had sent me a list of superficial themes, and I worked hard with her to get to a point where we actually had well-developed themes. So, and this, I felt, once we organized them, we actually could get to arguments. So working with burns patients is complex and challenging. That was the first theme. So she talks in there about, they talk about like, oh my gosh, this is so hectic. I can't even look at this patient. I need a period of desensitization. It's so intense. And then she moved on to clinical practice develops through having access to dynamic speech therapy teams and a multidisciplinary team. Then the third one was clinical practice develops through cognitive phenomena and evidence-based practice. That one I want her still to hone a bit, because I don't think she's actually conveying exactly what she wants to say with evidence-based practice. She kept on throwing in that term, and I'm saying, what do you mean? What do you mean? Is it application of evidence that they already know? Is it application of knowledge that they have? So that I feel we need to experience. Exactly. So what is she really saying there?
And that's
Clinical.
an example of where I'm wrong. You need to describe it clearly.
Yeah, you can't just say
Carefully, yeah.
evidence-based practice. I keep on saying to her, I don't know what you mean. What are you trying to say? Clinical practice is context dependent in this field. Patient condition impacts the development of clinical practice. Psychological and personality factors influence the therapist's development of clinical practice. So those are more or less the themes that she's got. She still needs to tweak them. She still needs to think about them a little bit. And I think we ended up collapsing one or two of them into one. So there was a refinement process, a lot of back and forth. And then, sorry, this is really small, but what we got to in terms of argument was, this is what I worked on with her, was working with patients with burn injuries can be overwhelming and daunting for several reasons. The condition itself requires a period of desensitization. Patients presenting with burn injuries are complicated to work with from a physical and a psychological point of view. There are limited guidelines and protocols. The condition itself deviates significantly from typical clinical practice and requires a more advanced set of skills in relation to problem solving, teamwork, application of knowledge, treating a patient holistically, all of that. Some therapists are able to embrace this new challenge using cognitive phenomena informed by personality and psychological factors. Some therapists can create new knowledge, draw from and create expertise within the multidisciplinary team and take risks to figure out how to provide optimal care to patients from burns injuries. They become passionate about working in the field. Other therapists realize the limitations of their experience and skills and their lack of confidence, and they may not have had the benefit and support of multidisciplinary team input. In such instances, they may step away, choosing to leave the management of patients with burns injuries to other therapists, i.e. they run far, far away because they realize their limitations. Whether a therapist ends up feeling passionate and confident about working in this field or instead chooses to step away seems mediated by a number of different factors, including context, experience in relation to context, availability of an NDT, the severity of the individual patient condition, the ability of the SLP to manage that, and personality and psychological factors in the individual SLP. So it's a bit of a mouthful, and quite complex, but that was kind of where we were able to get in terms of argument, which I feel was a lot further along the line of nuance and complexity than if she'd just given me, she'd said initially like cognitive factors, which didn't say anything, it didn't actually get us anywhere. So my feeling is that if one engages with this process of trying to develop the themes, you can actually get to a point where you can get to argument more easily. Yeah, sometimes better than other times. So tips and strategies, I guess, read widely. I've just got a new book on thematic analysis. Megan, I think you've got the same one.
Yes.
And it's sitting there waiting to be read, but now I need to
Have
just
you
find
gotten
the
the
time.
copy?
I did.
I'm still waiting for my copy.
Yes, I got mine the other day. I ordered it a year ago. And
I've also waited like over a year.
No, what happened was Narata had ordered these books. We are such nerds. Oh my gosh. So Narata had ordered the books, they'd arrived, and somebody found it in her office and thought, oh, that's a nice book, and took my copy. Yeah, so she had to order it again.
Yeah, I ordered mine.
Yeah.
Oh,
you
and
still
she
got
phoned me.
this
She was like,
stuff?
"Have you ordered the same book as Jenny?" And I was like, "I don't know, but I think so."
Yes.
And then she's like, "Yeah." Anyway, she delivered it, so maybe
Yeah.
so someone else also found it.
So I need to read widely. That is my challenge. I just don't have the time to sit and read sometimes, and yet this is the kind of thing we need to be engaging with. Spend time designing the study and pre-testing the interview guide. I think that is absolutely crucial, is that pre-test phase. And I know, like Sonta, we probably should have pre-tested that load shedding one as well, because we're now getting so much feedback from people, like, you didn't ask this and you didn't think about that. No, I'm sorry.
Well, we
were not the PI on this project in our defense, but we should have probably suggested a pre-test. Find a mentor or consultant, so your supervisor or somebody can help here. But, even this group is very helpful to just, and this discussion I found really helpful to kind of grapple with, do we distill down or do we fatten it up? What do we do in terms of themes? Choose the words in your themes very carefully. Do they convey meaning on their own? Can they stand alone? That, I think, is the key, is can it stand alone and does it have meaning? So like that example where the student's just saying evidence-based practice. So that is not helpful. That doesn't stand alone. So I guess, Rhoda, if you're a really clever writer and someone who can distill down to a word or a phrase, you could get there and convey meaning. But the average fourth year student is not going to get there. Yeah. Analyze in layers and in a circular way. So this constant back and forth, reanalyze it again, refining, going back, rethinking, can I regroup these themes, looking at that big picture. And just incidentally, that is one of the reasons why I did not like using Atlas TI software, because I found I was so deep in the details. I was struggling to see the bigger picture. And maybe that was just me and the way I was using it. But I think when you're doing this kind of analysis, you always have to have this back and forth between the big picture and the minutiae of the details and the nuance of the themes. Yeah, so that back and forth. So maybe scribbling it on a small or a big or whatever piece of paper, scribbling on a whiteboard, a blackboard. If anybody ever needs to use the blackboard in the lab, please go wild. While you're analyzing, if you want to do that, go for it.
Well, at the moment, we're just chatting about but we haven't got to the part of like linking them up into themes yet. I don't know. I mean, our list of codes is just getting longer and longer.
Well, that's the thing. And Megan, I was thinking of Sam Knoll's project. Remember, she did this hectic coding with colors.
Yes.
And it was insane. There were just like spreadsheets with probably about 20 different colors where she'd coded, and I could not make head or tail of what she'd done.
If it was helpful in terms, I suppose I probably would have taken on the same approach, but eventually she had so many themes and sub-themes that I think she ran out of colours in terms of
yeah, it was too much. And I opened it, I remember opening this document and I just closed it again. I don't know what to look at.
And she managed to remember what green means.
And she was brilliant. She was very good, and she came up with a
thorough,
It was
she
just
did. Yeah, but I remember trying to guide her as the supervisor and thinking,
So yeah, thinking about that big picture versus minutiae. Yeah, that was an example where I needed a big picture explanation. So often what I find is also just chatting through it. So, a student will send me some random, like all over the place set of things. I don't know what this means. Can we just chat? Can we meet? Can we chat?
Yeah.
Talk through what your logic is, because it's also about logic in the argument. What are you thinking?
I think it speaks to what you say, Renee, like sort of that summarizing and coming back to your main points and sort of, out of all of these things, what are you trying to say? If you can summarize it in one page, can you collapse things? Can you merge things? Are they all speaking to the same argument that you're trying to make?
I think there's incredible power in being able to talk about something.
Absolutely.
And again, sorry, you can see where my bias is at the moment is kids doing exams. They have to teach their work aloud. Like really, I know people learn differently, but that one I'm quite firm about, because being able to put it into words to an audience is quite a powerful way of exactly that, checking where you understand and checking where your own thinking is vague. And there's something happens when you talk it out loud versus even trying to write it.
Absolutely.
So I've got a friend whose father's a very top ex-judge, and apparently how he gets his summaries, because he's known in the industry for having the very shortest summaries for a complex case ever.
Oh wow.
But apparently he walks around for a couple of days talking out loud in the garden. A couple of days, I'm talking minutes, just having a conversation, and then he writes. but he actually talks it out for a couple of days. Now, I can't remember it. So I have to look like, but I find that fascinating that there is something in it.
I do that all the time. I'll be in the car and I'm like talking to myself.
Yes.
Yes. Yeah. I mean, I thought that was a sign of madness.
But great intelligence. Yeah. You heard it.
Yeah. And so you got to
Take
find
my word for it.
And I think you've got to find also what works for you. So the talking process is definitely something that all of us should be doing. But also, like for example, Megan, you found that writing an abstract is incredibly helpful for figuring out what you're trying to say. For others, I've made students sometimes put a PowerPoint together and then talk through the PowerPoint presentation. And that then helps to distill. And then sometimes I've had students who can do PowerPoint and talk beautifully but can't get it on the page. And that's a whole other story. But yeah, figuring out what's going to work to get you to argument and being able to explain your themes, the logic behind how you group them and how they link. Yeah.
But those, sorry, those students who can present but then can't put it on the page, maybe I think the usefulness of this talking out loud is you then figure out how to articulate what you think.
Absolutely.
Which helps with I find it helpful with the writing process, but maybe they don't remember the sentences that they produce after faced with writing it down. It might be helpful to have it recorded and played back to them, and then they hear, oh yes, I said this thing, I made this point, and I connected these things together.
And there's that app that'll do it for you. What's it? Otter.
Yes, Otter. Otter software.
Okay, it's not perfect because it's American. Well, I didn't mean it because it's American. It's our accents. So they do lovely things to our vowels. Sorry, nothing against Americans. They're excellent.
But finding that kind of a process or something that works for you. Sometimes what I'd also do when I have meetings with students is I say, okay, let's talk through your themes or talk through what's standing out, and then I jot down a few notes and then take a photo of what I've distilled from what they're saying, and then it's somebody else's perspective as well, and that sometimes is helpful. So refining themes and sub-themes. I think this is something that this article has really taught me to do, is not just kind of slap it on a page and it's good enough. No, it's not good enough. It needs to be refined. Ensure you have quotes and evidence to back up your themes. I think that's fairly easy to do, but the problem is sometimes that the quote is just plonked without any kind of interpreting. Yeah, exactly. And then sometimes I refer people to go and look at Braun and Clark's individual research work. Go and find one of their articles on a research project they've done, not writing about thematic analysis. And the one does, I think, gender studies or something. Go and find one of those articles and see how they've developed themes and how they've pulled things together in terms of the analytic work. So that's kind of it, and I think this has been a very useful discussion. So Leah, I don't know if you've got any points or things that you want to add, things that stood out from our discussion.
Thanks, Jennifer and the team. Team down there. I'm still in the initial stages of my qualitative, journey. I've always been a quant researcher, so I think I'm feeling a little bit overwhelmed, but I think what I'm going to take from this is that I really need to start reading more widely and understanding the methodology, as you said. I want to look at Braun and Clark's research work, and if there's anything else, Jennifer, that you think would be useful to help me on my qualitative journey, please will you share that with me?
Sure. Yeah. No. And just to say, Celia, we've got several people around this table who were very quantitative researchers and are now at very different stages of jumping into qualitative. So, lean on this group as well.
Thank you.
Because, we've been there, some of us.
I am here.
Yes, Siobhan is there in a big way. Siobhan's jumping into qualitative for the first time.
Okay.
From a very quant background. Yeah.
Yes. Absolutely. Thank you. I think these meetings will be very useful to help me build up my qual skills.
Yeah, definitely. Well, that's, I think we all learn from this. I've learned something today, and really sort of grappling with this point that Rhoda raised about distilling versus being too wordy.
Yeah.
Summarizing versus,
Yeah, it feels, it's hard to find the balance between, the distilling process and whether you need to put some more meat onto your theme. So I think you need to find a balance of what works for the research that you're doing.
Absolutely, yeah. And I'm battling at the moment that family medicine paper. The results themes feel too long. And I don't know where I'm going with those. And
I was thinking, I actually wanted to ask you, I don't know if I should talk about it now, but I wanted to ask you if I can maybe, because my mind works in diagrams and pictures and stuff.
Yes, that's why I said, please
If
do something.
if I can put something like that, it doesn't necessarily have to be in the article, but just
to help us
conceptualize it. Okay.
Please,
I wanted to ask you if I can do that.
Please, because I'm stuck. That's why I said, can you have a look at that piece of work, look at the results, and see if there's something we can do.
Yeah, because I started putting something together, then I thought, maybe you're thinking quantitative now, so maybe just find out how to do this.
No, this is why we have a team here, and the thing that I wanted to say as well is that there's no right or wrong with qualitative, because there is no recipe book of how to do it. It's about what's right for the particular project and the type of data, and then figuring out how you're going to sort that muddle out and make it into something cohesive. Yeah, so I'd love help with that. Thank you. Yeah. So I think we'll meet again. I'm not sure which date in September, but I'll send out details. And I don't know if anybody has come across an enlightening article on qualitative work recently.
I mostly read the ones you send me.
But if somebody comes across a wonderful article, then it would be great to kind of share presenting amongst us. And, this is a friendly space to grapple with and debate and engage with these issues. So, but thanks, Celia, for joining. It was great to have you. And you're very welcome to come and join in person if you would like to. Otherwise, we'll continue to run it as a hybrid.
No, absolutely. I'd love to come in person. So maybe our next meeting.
Yes,
I hope
sure.
to see you there. Yeah.
Okay, but I hope you have a good day further. And we'll
You
be in
too.
touch.
Thanks, Jennifer. Have a good day. Bye, everyone.
Bye.
Bye.